Hello, I'm Dr. Ester Yeoh, Endocrinologist at Aspen Diabetes and Endocrine Clinic in Singapore. Osteoporosis is a medical condition where bones become more brittle. In normal bone, it has a very strong interconnected structure, almost like a honeycomb with small and regular holes. It makes bones able to withstand stress. In the osteoporotic bone structure, the spaces between the honeycomb become larger, the bone walls thin out. This makes the bone more fragile. Yes, indeed, osteoporosis affects both men and women, and it is common in older adults, especially women after menopause, but men can get osteoporosis too. Risk factors include aging, hormonal changes, a lack of calcium or vitamin D in the diet, a sedentary lifestyle, smoking or excessive alcohol use, and a family history of osteoporosis. Osteoporotic fractures tend to occur in the hip, spine, and wrist. Now, fractures in these sites can cause pain, limited mobility, and even disability. For instance, compression fractures in the spine can cause back pain, height loss, and a stooped or hunched posture. Now, hip fractures are particularly concerning because they can lead to prolonged recovery, disability, and even increased risk of death. Screening for osteoporosis is recommended for postmenopausal women aged 65 and above and men above the age of 70. For women younger than 65 years of age, I would also screen based on the presence of other risk factors such as low body weight, family history, long-term use of steroids, or certain medical conditions that can affect bone health. Now, screening for osteoporosis involves a bone density test, also known as a DEXA scan, to determine the strength and health of your bones, most commonly at the hip and the spine. Now, endocrinologists like myself, we specialize in hormones and metabolic disorders. We can help to diagnose an underlying cause to the osteoporosis. And some cases of osteoporosis are what we call secondary to hormonal imbalances, such as a thyroid disorder, calcium disorders, or low testosterone, estrogen, or even excess steroids. If there is treatment of the underlying cause, we can manage complex cases, particularly osteoporosis that is severe, happens in younger individuals, or bone density that does not improve with treatment. We are also experienced with the range of osteoporosis treatments, such that if standard medications aren't working well or causing side effects, we can offer other options. We can also interpret complex lab tests like bone turnover markers, vitamin D and calcium metabolism tests, and different hormonal tests. So I would recommend all of us to have adequate calcium and vitamin D intake to participate in physical activity. And last but not least, for those at risk, I would recommend screening for osteoporosis with a bone density test.